for 20 plus years as a general surgeon, I saw a good number of men who would complain about breast enlargement. The medical term for that is gynecomastia, and it can be a very bothersome, very painful, emotionally situation for men, both young men, young boys, as well as older men. And I have taken care of young teenagers with their parents' consent in terms of male enlargement, breast enlargement, as well as gentlemen in their 70s who are still bothered by having female breasts type of appearances. And emotionally, it's really tough on men. In the younger generation and even in the older generation, a lot of times they won't even take off their t-shirt, even on a hot day, because they're so embarrassed. They get ribbed by their buddies, constantly getting kind of pinched all the time by their buddies, and it's very, very bothersome for them. So let's just talk about that for a minute. So gynecomastia, or male breast enlargement, is something that is just part of a hormonal imbalance and also the target tissue, which is the breast tissue in men, where it can enlarge. And we all, as men, have breast tissue. We tend to think of breast tissue only in women, but we actually have glandular breast tissue under our nipple areola area, or what we call the areola. And so in some people that can enlarge. Sometimes it can be tender, very painful. And for most men, in young men, it's usually the protrusion that makes them feel that they look like a girl. And that's very, very hard for them. Very much like acne in a teenager, it can be devastating. This is also a very painful issue for young men and older men as well. As I mentioned, I recently just took care of a 70-plus-year-old gentleman who had this issue all his life, and he is so happy that we've taken care of it. So what can we do for men with gynecomastia? Okay, so if it's just glandular tissue, maybe a plum-sized amount of tissue and so forth, a lot of times just under local anesthesia, and it's very, very comfortable procedure, we make a little, I'm going to say, semicircle incision on the bottom half of the areolar border, between the areola red pink area and the normal skin color. And we go from about 3 o'clock to 9 o'clock on both breasts. We inject local in there. You don't feel it at all except for the injection of the local anesthesia. And we remove, or surgically remove, that tissue. Just by doing that, it can make a world of difference for men in terms of having a flatter area, not having a protrusion like one might see in a woman. Okay, so that's called an excisional glandular removal, or excisional, meaning excised, gynecomastia surgery. And that's really been the standard, and I've been doing that now for 40 years. And I have to tell you that our patients are very, very happy. There's very little downtime with that, maybe about a week or so, where we're not asking you to be running around working out. And most people can probably return back to work if they do a desk type job within a day or two. So it's very well tolerated. I was the first surgeon in Northern California to introduce SmartLipo, or laser liposuction. And that is a procedure, again, done under local anesthesia. That's the only way I do surgery. We inject it in that area, and we would use the laser to try to break down the glandular tissue and then be able to suction it out without having to make an incision. And then the surrounding fat in maybe a male whose breast is enlarged, not just the glandular tissue underneath the areola, but sort of the whole chest area. And I will tell you through experience, and that's important to go to someone with experience, is that I found that using the laser liposuction on the glandular tissue was really underwhelming. I didn't feel that it did the type of job that our patients were expecting in terms of results. However, that laser liposuction, in terms of removing fat in the general chest area that might make a male look like he has a large female breast, can be highly effective. So when you come in, and our consultations are complimentary, we'll evaluate you, take photos, I'll do an examination on you. And if you have somebody who just has glandular tissue, we may be lucky enough just to be able to do an excisional removal of that tissue. However, if you have a bigger breast area and a good part of it is fat, then we would probably recommend a combination of SmartLipo, or laser liposuction of that whole area, and also doing a and excisional removal of the glandular tissue under the areola. Okay. And that will probably take care of 95% of all the men that come in to see us for gynecomastia. However, occasionally you'll get somebody, especially males with a lot of weight loss, who may have such drooping of that breast tissue, just like in women, that they may require actually a formal breast lift. And that's where we would go. And it's a little bit more detailed than what we would share with you on our show today on KSRO Ask the Expert. But if you have any further questions about that, we'll have you give our office a call. You will speak with Karina, who's not with us today, but our surgical liaison. She's wonderful. And we'll have you send in some photos and we can set up a consultation for your gynecomastia issue. And again, it's one of my favorite operations because of how happy our patients are. So that's the treatment for male gynecomastia.